Many people cannot control when and where they urinate. Some people cannot even control having a bowel movement. This is a problem for elderly people more commonly than younger people. It's not their fault, and it is not a normal part of the aging process. Rather, it's a health problem, and you're key to helping change this. Hi, I'm Kathy Getrust, and I'm an instructor in community health. Today's topic of discussion is going to be on bowel and bladder retraining. We'll begin today's discussion by watching a segment of a videotape that's been graciously supplied by the Paper Pack Products Company, a company which manufactures disposable incontinence products.
Welcome to the Attend's Advanced Skin Health System, the incontinence and skincare system designed to help caregivers provide quality care, help maintain healthy skin, and manage related costs. In the first section of this videotape, it's an introduction to incontinence and its effect on skin health. You'll also learn about the Attend's Advanced Skin Health System and its comprehensive approach to managing incontinence to help maintain high health skin. Incontinence is the inability to control urination or movements. It can range from tiny pills to complete loss of control. It affects more than 10 million people in all walks of life and at all ages. And it can lead to personal embarrassment, isolation, and serious skin problems. Although it is most common in older adults, it's important to remember that incontinence is not an ordinary part of aging. And incontinence is not an illness in itself, but rather a symptom, a sign or outcome of some other illness or physical problem. There are two different kinds of incontinence: bowel or fecal incontinence and urinary or bladder incontinence. Bowel incontinence is the inability to control the passage of feces. It is caused by diseases or injuries to the nervous system, or by problems or weakness in the colon, rectum, or anus. It can also result from physical or emotional barriers to getting to the bathroom. Urinary incontinence or bladder leakage is the most common form of incontinence. It occurs when the bladder contracts or empties when it shouldn't, or when the bladder's outlet or sphincter opens or closes at the wrong time. Its cause can be problems in the urinary tract, the pelvic floor muscles, the spinal cord, and even problems in transmitting messages to and from the brain. If any one of these areas is unable to function normally, a person loses bladder control and urine is released at the wrong time. Here are some of the most common causes of urinary incontinence. Relaxation of the pelvic muscles. This is often seen in women over 35 who have had several children. Reduced pelvic muscle control, which can occur with menopause. Infection or inflammation of the bladder or the urethra, the tube that leads from the bladder to the outside of the body. Nervous system disorders, which can result from birth defects such as spina bifida, from brain damage or stroke, from diabetes or a spinal cord injury. Neuromuscular diseases such as multiple sclerosis, muscular dystrophy, and cerebral palsy. Damage due to injury or as a side effect of some types of surgery. And finally, certain medications, as well as caffeine and alcohol, can make incontinence worse. How severe a problem is incontinence? It varies from person to person and even from day to day. Generally, there are 3 degrees or levels of severity of incontinence. Light incontinence is occasional uncontrolled dribbling and spilling of small amounts of urine. Moderate incontinence is partial loss of control, resulting in voiding of small to moderate amounts of urine. Severe incontinence is uncontrolled total voiding of moderate to large amounts of urine and/or stool. In addition to degrees of severity, incontinence is also classified into 5 main types. Stress incontinence. This is the most common type of incontinence. It is the involuntary leakage of small to moderate amounts of urine following sudden stress on the bladder or sphincter, such as coughing, laughing, sneezing, bending, or lifting. This condition is most often associated with a weakness in the pelvic floor muscles. Urge incontinence. This is the loss of moderate to large volumes of urine in conjunction with a sudden need to urinate that is so urgent it can't be held back. It results from an overactive bladder contracting when it shouldn't, because the brain's ability to transmit has been inhibited by a nervous system disorder, such as a stroke or a disease like Parkinson's. Overflow incontinence. This is the leakage of moderate amounts of urine from a chronically full bladder. It is caused by an obstruction, such as an enlarged prostate, or a problem in the bladder contracting or emptying mechanism, resulting from medication, a disease like diabetes, or spinal injury. Reflex incontinence. This is complete loss of control, most often due to an injury to the nervous system that blocks messages between the brain and the bladder. It is the most severe type of urinary incontinence and typically results in the loss of large amounts of urine. Functional incontinence. This results from a physical or emotional barrier to toileting. Examples of physical barriers are immobility, an inaccessible bathroom, and bed rails or other restraints. Disorientation, depression, and behavioral problems are examples of emotional barriers. Whatever the cause or severity of incontinence, our primary goal is to protect the person's health and dignity. Incontinence can often be treated and cured with medication, surgery, or behavioral programs like bowel and bladder retraining. Always consult a doctor for a thorough evaluation of any incontinence problem and a plan for treatment. For many people, however, incontinence is managed through use of disposable absorbent containment products combined with quality skin care. Perineal care, often referred to as pericare, the regular cleansing of the skin in the genital and anal area, is an essential part of quality incontinence care. The goal is to help maintain healthy skin and assure that each person receives the quality care he or she needs to achieve the highest practicable level of functioning and quality of life. Quality incontinence care is important because incontinence is a predisposing factor for skin breakdown. Skin that is soiled or continuously wet is more easily attacked by bacteria or fecal enzymes that can cause rashes, infection, and skin breakdown. The skin may also be prone to fungal diseases such as yeast infections. This skin breakdown can lead to diminished quality of life and to very serious health problems, even pressure ulcers, when combined with pressure and immobility. The